back in 2007. Just not long ago, they announced the shelving of the project. And there was a big, huge question mark as to where they're going to go next. They ran into all sorts of political difficulties around privacy and confidentiality. They ran into serious political difficulties in that physicians didn't want to pay the money to install the equipment that was needed. And they chose, strategically not wise, to expect the physicians to pay for the equipment as opposed to paying for it. And there was enough of an uproar around the concern about confidentiality that at the moment they've shelved the efforts. They've already spent $1.5 billion, which is, well, I guess it's in pounds. This probably came out of an English publication, so they translated from pounds. Germany's obviously in euro. That's about the same. Euro and pound are pretty close together. So they've already spent 1.5 billion euros, and they've decided for the time being to shelve it. They've not made the health insurance companies. The health insurance companies are probably the most significant driving force in the healthcare system of Europe. Everyone has to be registered with a health insurance company. There's a lot of them, many of them, and they basically drive the system as to who gets what care, what condition, sort of thing. And they're not happy that this has been shelved because the card also would have a picture on it, and it would stop some of the fraud and misuse of the healthcare system. But now that they don't have that, they're advanced. So they're another country that's in the hole. So, before we go on to Italy and the rest of Europe, let's take a little break, okay? My throat's getting dry. A 15 to 20 minute break and we'll continue on, okay? Okay, Italy, Italy. In terms of their GPs, more or less on the European average. But you can see that Italy has almost no transmission of laboratory data between laboratories and physicians' offices, whereas there's a little bit of that in the rest of Europe. Okay, Italy doesn't have a national policy. Another country that hasn't gotten around to doing something national. Okay? I'm not enough of a historian as to whether or not it's because Italy, I don't think it's had a stake in government for the last 20 years. Where else planning to do it, but it probably does have a bit to do with it. Because Dick mentioned, gave it one key word today, an absolute key word, and I will repeat it later on today. An absolute key word on this one.
The Vatican have their own health system.
I can't answer that, Sherman. They got some beautiful buildings, I know that. I imagine they have their own health system to a point, to, I'm sure, a primary care point kind of thing for people that live inside that city, because it's a city, of course.
Or contracted out.
Sorry?
Or contracted out.
But I imagine for anything beyond primary care, they go to the hospitals in Rome. So can't answer that, I'm sure. Okay, however, notwithstanding that Italy doesn't have a national direction of any kind that anyone can sort of pick out, well, I'm looking forward to reading the Italian report. It hasn't come in yet on this new study of the part. I'm looking forward to seeing what it says about Italy. They do have one particular very effective regional strategy. Okay, i.e. province. It is the province of Lombardia in northern Italy, based out of Milan, as sort of the central part. 8 or 9 million people, and they are though they're missing a national policy, it says e-government's already advanced and there is some regional efforts. So Lombardia is definitely one of the regional efforts. I guess I should flag out that first slide. And they have an online health record. They've got another somewhat unique approach that they've adopted that works. Okay, 9 million citizens. It's a big province, so to speak. And 8,000 general practitioners and pediatricians. In their case, the GPs and the pediatricians work side by side. And they have a smart card, both for the citizens and for the healthcare practitioners. And they are quite interconnected. Most of the healthcare organizations are part of a network. And they have a system which they refer to as their Health and Social Services IT system, run out of Milan. And it's based on 2 cards. The card on the left is the patient card, which I don't think has a picture on it. And the patient card at the back of the patient card, Italy's, a number of countries now are starting on the back of their patient card. And this is a regional card, it's not a national card, it's a regional card. It's a regional card. But they're putting on the back of it the EU card. Because every citizen of all the countries is being assigned, has been, or is being, I think has been, assigned an EU number. Okay? And eventually, it seems just a matter of time before EU cards start to be generated. And at the moment, though, a lot of companies or countries and regions are putting the EU card in the back of the patient card. And then the other card is the professional's card, the health professional, okay, which I think, I'll have to double check. I think when we say that, I think it's only physicians, as opposed to nurses as well.
Right.
Yeah, I'll check that out. What?
So the EU card, is this an EU like health card, or is this like an identification?
No, it's an EU identification card.
So it's like their EU passport type thing? Or?
Well, who knows where it's going to go? I mean, at the moment, it's not a card that's used very much.
Okay.
But they've obviously finalized the format of the card and whatnot, and at the moment, it's a swipe card. And I'm not sure if it's being used anywhere yet, but it's obviously, as the EU evolves, they will, they've obviously got something in mind for it, otherwise they wouldn't bother creating it. And I doubt if it will replace a passport, but if they put a picture on it, then it might. It could easily replace the passport. So I guess just to finish, the approach in Italy is unique. They have a central repository which keeps track of all 9 million people with a set of pointers. And when a clinician, be it a physician, a family physician, particularly a family physician, but also specialists in hospitals. Now, that's another thing about many European countries and quite a few countries around the world. The specialists all work in a hospital, and in a lot of cases are employed by a hospital. Okay, so they don't have their own systems. They use the hospital system. So they work, and if they have an office, so to speak, it would be in one of the ambulatory clinics attached to the hospital. That's a quite different model than the Canadian model, where all of our specialists are on fee, for the most part, except for a few that are fee for service. Yeah.
Just following up on that EU card. So it says on their website that it's a form of health insurance card.
Oh,
So
okay.
it gives like people access to public health care in any one of the 27 European countries.
Good. So it's restricted to health, it looks like. So it's a health card.
Yeah, it's a health insurance card.
Yeah. Yeah. Okay. Thank you for that. Yeah. So the situation in northern Italy is that the central repository, which is run by a freestanding organization, which is, I think, mainly owned by the Department of Health, but it's a freestanding organization. It's an interesting model. It's not inside the Department of Health, it's outside the department, a bit like Info from that point of view. But they are also a processing center. Info doesn't do any processing. And when a GP wants to see a radiology report that a patient has been to in any of the hospitals in the region, within the province, they access the central registry. The central registry goes to the radiology department and or hospital information system of that hospital and pulls out a PDF file which is sent back to the GP. Where they made their investment is in building their network and building in a PDF repository capability in every one of their hospitals. So that all the reports that go into the hospital information system, a copy of that report goes into the hospital's PDF repository, which stays in the hospital. But it's there strictly for access to data from outside the hospital. So when the GP comes into there, it doesn't come into their system. Makes a request to the central repository dives into the hospital, into this copy repository, pulls the report, fires it back, and I can't answer whether or not the GP then has been stored in their system. I suspect they probably can. But that's the way they do it. It's all PDF.
How do they know where it was done?
That's based on, well, they know that they have to depend on the patient telling you where they went.
Patients don't.
Well, that's their system. But you've got to remember too, in Italy, patients, you wouldn't believe it, what Italian patients have to do. They carry medical records around from one hospital to another. They carry their own record in a lot of cases. They don't have an x-ray, they got to carry the x-ray with them to the next doctor they're going to go see. It's quite a different system, quite different than ours. And therefore the x-ray agency, sort of their responsibility over once they give their x-ray to the patient to take with them to the next doctor.
You could argue that's, in a way, better because
Yes.
it's my incentive to ensure I have everything.
If you lose it, it's your tough luck.
It's a very different approach. It's another unique approach. Very pragmatic. Didn't cost them very much money to build this. Basically, they're just, they're building the software. I think they only have, there's only 4 or 5 different hospital system vendors. And they just mandated that you must build in this capability inside your system. Hook yourself up to the network, and then once a request comes in from the central repository, we want to see this particular report, ship it back. It costs them a lot of money.
Is that like a homegrown system?
Yes, I think it is for the most part. It's built by this company that they created, it's the Department of Health created. And there's quite a heavy involvement in this company of also the private sector. There's a number of vendors involved in this company too. So it's a very unique approach.
Sorry, I mentioned that before in our other class. Maybe some people do not know that here. Back home in Iran, we do the same thing. And I think that we have a small books that we carry, and doctors put the information and the medication on that. And we carry our radiologies and we take care of them. And the system worked very fast for us. And the response is very fast. And when I came to Canada, I didn't believe that Canada system is like this. Because we receive more care faster and cheaper, and we see by specialists very fast, and we go for the, if a GP see you, the day after that you will be seen by a specialist, and in the same day you can go for MRI or whatever you want.
Don't get us, don't please, that makes us all feel so bad.